There are two joints that you have to know for Chapter 9, Articulations. One joint is the shoulder joint and the other is the knee. This is the shoulder joint, and we need to know ligaments on the shoulder joint. To get our orientation, this is the clavicle, this is the scapula, and projections off of the scapula are the coracoid process and the acromion process, and this is the humerus. So there's two ligaments that you can't see on this model. Those are the glenohumeral ligament and the coracohumeral ligament. Those will be on a diagram. One of the ligaments that you can see on this model is the Coracoacromial ligament. This is the coracoid process. This is the acromion process. So this ligament attaching bone to bone is the Coracoacromial ligament. The next ligament that you should see is the Coracoclavicular ligament. Again, this is the coracoid process. This is the clavicle. So the ligament attaching the coracoid to the clavicle is the Coracoclavicular ligament. And the last ligament is the Acromioclavicular ligament. Again, this is the acromion. This is the clavicle. So this ligament attaching the two is the Acromioclavicular ligament, otherwise known as the AC ligament. This is the knee joint. In the knee joint there are several ligaments that you have to know and one tendon. The tendon is the quadriceps tendon that attaches the quadriceps muscle to the patella. So this is the quadriceps tendon. The patellar ligament attaches the patella to the tibial tuberosity of the tibia. So this would be the patellar ligament. And then there's two ligaments on the side, the fibular collateral ligament and the tibial collateral ligament. So on the lateral side of the knee, we have the fibular collateral ligament. That is the ligament that extends from the femur down to the fibular head. On the medial aspect of the knee, we have the tibial collateral ligament. That's the ligament that attaches the femur to the tibia. If we look deeper inside the knee, we're going to find two cartilages that are called the meniscus. There's the medial meniscus and the lateral meniscus. We know this is the lateral side of the knee because this is the fibula. The fibula is on the lateral side. This is the lateral meniscus, the cartilage in between the femur and the fibula. On the medial aspect, and we know it's medial because this is the tibia bone, this is the medial meniscus, this piece of cartilage that's between the tibia and the femur on the medial aspect. The two other ligaments that you have to know are called the cruciate ligaments. They're the anterior cruciate and the posterior cruciate ligaments. These ligaments crisscross deep inside the knee joint. The best way to tell if the ligament is an anterior or posterior cruciate is to look to see where does it insert on the tibia. This ligament right here inserts on the tibia on the posterior aspect and then crosses through to the anterior aspect where it inserts on the anterior aspect of the femur. That we would call the posterior cruciate ligament. This is the anterior aspect of the knee, and we're looking deep. I've moved the patella away, as well as the patellar ligament and the quadriceps tendon. And if we look deep inside, we can see the lateral meniscus and the medial meniscus. And we can also see this ligament here that's one of the cruciate ligaments. It's the anterior cruciate ligament because it inserts on the anterior aspect of the tibia. And then it courses its way back to the posterior aspect and inserts on the posterior aspect of the femur.